Welcome to class on electrolytes. In this section, we're diving deep into high-yield electrolyte topics, focusing on the causes and management of both hypo and hyper concentrations of key electrolytes. Not only will we cover the critical nursing interventions, but we'll also help solidify your understanding with Nclex style practice questions to ensure you're exam ready. Electrolytes play a vital role in maintaining the balance of our body systems, from nerve function and muscle contractions to regulating fluid levels and blood pressure. Understanding their importance is essential for providing effective nursing care and ensuring patient safety and your performance in the Nclex exam. Without much wait, let's head into today's topic. Sodium is an extracellular electrolyte that is basically found in the plasma. The normal range for sodium is 135 to 145 milliequivalents per liter. The amount in body is regulated by the kidneys, which excrete or absorb sodium. Within this range, our body absorbs sodium to conduct nerve impulses, contract and relax muscles, and maintain the proper balance of water and minerals. What happens if this amount is less? Your answer should be hyponatremia. We learned that our body needs sodium to conduct nerve impulse. So, less sodium can lead to certain nervous problems like seizures, nausea, confusion, restlessness, etc. It is needed to contract muscles, so low sodium can cause muscle weakness and fatigue. And as it is needed to maintain proper balance of water and electrolytes, a low amount can trigger depletion of energy, headaches, and seizures. So what are the causes? Two reasons could be taken as causes. The first is high level of sodium excretion, which may be due to diarrhea, diuresis, or excessive diaphoresis, and second is low sodium intake or sodium reabsorption in certain kidney diseases. Hyponatremia may also be the cause due to Addison's disease, hypothyroidism, renal failure, heart conditions, or certain medications like diuretics, mainly the loop diuretics, which reject the sodium and water from the body. You may also see hyponatremia in people who fast for a long time. We thus learned that our body needs sodium in a proper range. So, what should be the nursing intervention of hyponatremia? If hyponatremia is due to fluid or blood loss, vomiting, or diarrhea, you may provide sodium chloride or infusions. If primary cause is caused due to excess fluid volume, you can provide diuretics. In this case, you have to provide osmotic diuretics, not other diuretics, as they promote more sodium excretion. If diseases such as Addison's disease is the cause, you may have to choose the hormone replacement procedure. If drugs such as diuretics is the cause, your job is simply to reduce the dose or to completely eliminate the use of the drug. Hypernatremia. If the sodium level in the body is greater than 145 milliequivalents per liter, the condition is known as hypernatremia. This is not only due to high sodium intake in diet, as our body has mechanisms to excrete the sodium from body. More often, it is the result due to strong physical works and exercise for a long time or exposure to heat and dehydration. The other reasons are decreased sodium excretion due to certain kidney diseases, Cushing syndrome, use of drugs such as corticosteroids, etc. Sometimes even excessive IV sodium-containing infusions can lead to hypernatremia. So, what could be the nursing intervention for hypernatremia? Simply keep the sodium level in range. This could be done through dietary restriction of sodium. If the cause is due to loss of fluid, you may give IV infusions, or if it is caused due to low renal sodium excretion, you can administer diuretics. Note, never use osmotic diuretics, as this won't excrete sodium. Our job is to excrete the sodium, but keep in mind that rapid reduction of sodium should be avoided, as along with sodium, there could be loss of water from the body too. Rapid loss of water from the body can lead to cerebral edema, and it is a very dangerous condition. Let's solve a practice question out of all that we studied recently. I will give you some time to go through the question. Please do not forget to check out the timer. If you need more time, please pause the video and I will check your answers in the comments section. Please write the name of topic and the option number that you feel is the right answer in the comments section. By the way, the strategies we've been talking about in this video, those approaches for tackling tricky Nclex questions and managing the different types of questions are actually taken straight from a resource I really recommend. The new Nclex R in Practice Question Bank. If you're looking for a great way to practice and apply those strategies, this book has over 700 questions that mimic the real exam format, and each one comes with detailed explanations that help you understand exactly why the correct answer is right and why the others aren't. It's a great way to reinforce the strategies we've been covering here today. This book is especially useful if you're struggling with the new next generation Nclex format or just need a structured way to build up your confidence with daily practice. You'll find it's all about practicing smart, not just hard, and really honing your test-taking skills. So, if these strategies are helping you out, this book could be a solid next step to boost your preparation even further. Just thought I'd share that in case it's something you want to check out. You've got this. Potassium is intracellular electrolyte needed for various bodily functions. The normal level 3.5 to 5.0 milliequivalent per liter. Within this normal range, it helps to maintain the fluid balance. It is the main electrolyte in the intracellular fluid, and it determines the amount of water inside the cells. It also facilitates the electrical impulses, helps regulate your muscle contractions, heartbeat, reflexes, and many other body functions. So what happens if our body is short of potassium? What happens if it's less than required or lesser than 3.5 milliequivalent per liter? This is called a hypokalemia. Chronic lack of potassium in diet may cause hypokalemia. The causes are much similar to the causes of hyponatremia. It can be due to potassium loss from the body due to medicines like diuretics, corticosteroids, frequent and heavy diarrhea, and vomiting, or due to certain other diseases such as kidney diseases. Let's now see the nursing interventions for hypokalemia. First, as with all conditions, we monitor the cardiovascular, GI, or the renal status and electrolytes level in the serum. We learned that potassium is needed to maintain muscle contractions. So, low potassium levels result in muscle weakness, fatigue, and numbness. Also, we studied it helps to conduct reflexes. Lack of this can cause numbness. It is also required to regulate the heartbeat. Lack of potassium can cause palpitations, and in more chronic or severe hypokalemia, this can cause cardiac arrest. So, what could be the treatment? Moderately lower potassium level can be supplemented with introduction of dietary potassium sources, such as banana, spinach, or other green leafy vegetables in diet. However, severe hypokalemic states can be treated with supplemental potassium. Note one important point that supplemental potassium cannot be given via the IV push, subcutaneous, or intramuscular routes of administration. It can be given as IV infusion after dilution. Now, let's see what happens in the hyperkalemic states. It is the condition when the potassium level is greater than 5 that this is very dangerous, as it may cause dysrhythmia, which may result in cardiac failure. It can be due to certain medications like diuretics, generally potassium-sparing diuretics such as amiloride and triamterone. It may be also due to certain renal insufficiency with Addison's diseases and heart diseases. Rapid infusion of potassium-containing solution may also cause the hyperkalemia. So how can we manage the hyperkalemic states? If the hyperkalemic state is not that severe, dietary potassium restrictions, such as use of less amount of salts, green vegetables, etc. can be done. You have to discard infusion of any potassium-containing moiety. In severe states, it can be done through medications, or in some severe states, also with the help of renal dialysis. Let's solve a practice question out of all that we studied recently. I will give you some time to go through the question. Please do not forget to check out the timer. If you need more time, please pause the video and I will check your answers in the comments section. Please write the name of topic and the option number that you feel is the right answer in the comments section. Calcium is one of the important minerals associated with healthy bones and teeth, although it also plays an important role in blood clotting, helping muscles to contract, and regulating normal heart rhythms and nerve functions. The normal level of calcium is regulated by kidneys as well as hormones such as calcitonin and parathyroid hormones. Parathyroid hormone increases the calcium level and calcitonin decreases calcium level in the blood. Hypocalcemia. The reasons for hypocalcemia are low level of dietary calcium. As vitamin D is required for calcium absorption, vitamin D deficiency could also be the reason for hypocalcemia. Certain drugs can also cause hypocalcemia as these affect the calcium reabsorption from the body. Examples of such drugs are phenytoin, phenobarbital, anticonvulsants, bisphosphonates, rifampin, etc. It can also be due to inhibition or increased calcium absorption from the gut. Calcium inhibition may be due to inadequate calcium dietary sources or malabsorption diseases such as Crohn's disease or problems like lactose intolerance. Increased calcium expression may be due to diarrhea and kidney conditions such as polyuria. So how can we identify hypocalcemia? First is obvious, see if serum calcium level is less than 9 mg per deciliter or see prolonged ST and QT interval. As tests for hypocalcemia, you can also look for different gestures of hand and facial muscles. For example, the patient shows Trosso's sign, which is a carpal spasm which can be induced when the blood pressure cuff is inflated. Another sign is Fostex sign, which is contraction of facial muscle when you tap the region over the ear. So what could be the treatment? Increase the calcium intake from the dietary sources. Dairy products are the rich dietary sources of calcium. Give calcium supplements and vitamin D supplements. Also, see if some other drugs such as phenytoin, phenobarbital, anticonvulsants, bisphosphonates, rifampin are affecting calcium absorption. If there is hypocalcemia concomitantly with the intake of these drugs, you may want to adjust the dose. One very important nursing procedure for patients with hypocalcemia is as there are chances of pathological fractures, you should move the clients slowly and carefully. For acute calcium deficit, you can also use 10% calcium gluconate. Hypercalcemia. When the calcium level in the blood serum is more than 10.5 mg per deciliter, it is known as hypercalcemia. The causes may be certain diseases such as hyperparathyroidism, hyperthyroidism, certain kidney diseases, or certain drugs such as glucocorticoids, lithium thiazide diuretics, or excessive oral use of vitamin D. As nursing intervention, your job is to monitor the cardiac function of the patient. See for the shortened ST and QT interval, or discontinue any drugs such as vitamin D, diuretics, etc. Generally, in this state, the low level of calcium in blood is compensated by retaking the calcium from bone, so there are chances of pathological fractures, so you should move the patient carefully. Drugs such as phosphorus biphosphates and calcitonin can be given so that calcium resorption from bones can be decreased. In some states, dialysis of patients may be necessary. High level of calcium is the reason for kidney stones, so one way to check this is straining the urine for any presence of kidney stones. Let's solve a practice question out of all that we studied recently. I will give you some time to go through the question. Please do not forget to check out the timer. If you need more time, please pause the video and I will check your answers in the comments section. Please write the name of topic and the option number that you feel is the right answer in the comments section. magnesium. Another important electrolyte is magnesium. Magnesium is needed for regulating muscle and nerve function, blood sugar levels, and blood pressure, and making protein, bone, and DNA. The normal level of magnesium in the blood is 1.3 to 2.1 mg per deciliter. Anything lesser than this range results in hypomagnesemia. Hypomagnesemia. The causes of hypomagnesemia may be insufficient magnesium intake due to vomiting, diarrhea, malnutrition, or certain diseases that hinders absorption of minerals such as celiac and Crohn's disease, or excess expression of magnesium due to diuretics. Certain drugs that hinder absorption of magnesium may also be responsible for hypomagnesemia, such as proton pump inhibitors, anti-cancer drugs, cisplatin, cyclosporine, aminoglycosides, amphotericin, etc. Please keep a note that people with long-time insulin therapy and alcoholism may also suffer from hypomagnesemia. So what should be the nursing intervention with hypomagnesemia? Monitor all the vital signs. Drugs may be discontinued if the mentioned drugs could be the cause. Magnesium sulfate IV infusion may be one of the ways of treatment. Also, keep a note that hypomagnesemia is also associated and accompanies hypocalcemia, so the nursing intervention should also be focused at maintaining the normal calcium levels. After hypomagnesemia, let's look for hypermagnesemia, that is when magnesium level is more than 2.1 mg per deciliter. So, what could be the causes? The causes could be increased magnesium intake or decreased magnesium excretion. The reasons for increased magnesium intake could be excessive infusion of magnesium containing infusions or laxatives or antacids containing magnesium. The reasons for decreased magnesium excretion could be any renal disease of renal inefficiency. So, what should be the nursing interventions in hypermagnesemia? Discard excessive infusions of magnesium. Discard laxatives or antacids containing magnesium. Restrict magnesium-containing foods such as avocado and cauliflower. Increase magnesium renal clearance with diuretics, and as I mentioned earlier along with magnesium, we have to look for calcium level also, so to reverse effects of magnesium on heart, you can administer calcium chloride or calcium gluconate. Let's solve a practice question out of all that we studied recently. I will give you some time to go through the question. Please do not forget to check out the timer. If you need more time, please pause the video and I will check your answers in the comments section. Please write the name of topic and the option number that you feel is the right answer in the comments section. Phosphate. The normal level of serum phosphate is from 3 to 4.5 mg per deciliter. Phosphorus helps filter out waste in the kidneys and plays an essential role in how the body stores and uses energy. It also helps reduce muscle pain after a workout. About 85% of the phosphorus is stored in teeth and bones. So, what could be the effect on our body if the phosphorus level is low? Hypophosphatemia. This occurs when the serum phosphate level is lower than 3 mg per deciliter. The causes could be due to increased phosphate excretion or decreased phosphate intake. There is generally increased phosphate excretion in certain conditions such as hyperparathyroidism and respiratory alkalosis. Also, decreased phosphate intake in malnutrition may be also reason for hypophosphatemia. What could be the nursing intervention for hypophosphatemia? Note that there is reciprocal relationship between phosphate and serum calcium level in the body. If there is a decrease in serum calcium, there could be increase in phosphate level, and if there is decrease in phosphate, there could be increase in serum calcium. So you have to take this point in mind. For example, if a patient is phosphate deficient, you have to take low amounts of calcium-containing foods or supplements, since that time, the serum calcium level might be high. You have to discontinue medicines that cause hypophosphatemia and slowly infuse the IV phosphate solution. You also have to access for renal conditions and other vital signs. Hyperphosphatemia. When the serum phosphate amount is greater than 4 mg per deciliter, it is defined as hyperphosphatemia. Note that as we studied earlier, when there is hyperphosphatemia, there could be hypocalcemia, as there is an inverse relationship. So, all the effects of hypocalcemia could be seen in hyperphosphatemia. You can revisit the lecture portion on hypocalcemia to revise those points. All right, let's see the cases of hyperphosphatemia. It can be due to decreased renal clearance of phosphate in certain renal diseases or increased phosphorus intake due to phosphate-containing laxatives or enema. It could also be due to conditions like hypoparathyroidism. What could be the nursing intervention? As we have frequently talked earlier, the management approach of hyperphosphatemia is similar to management of hypocalcemia. Phosphate-containing laxatives or enemas should be discarded and phosphorus-containing supplements or foods should be discarded. We can also administer some drugs that bind with phosphorus can increase the fecal expression of phosphorus. Let's solve a practice question out of all that we studied recently. I will give you some time to go through the question. Please do not forget to check out the timer. If you need more time, please pause the video and I will check your answers in the comments section. Please write the name of topic and the option number that you feel is the right answer in the comments section.